Well, welcome and happy May Day. It is indeed Friday, the 1st of May. The year seems to be going really quickly. Now, the first thing I want to do today, I've got a very large-scale epidemiological study to bring you about comorbidities and symptoms from the UK. Now, we have had similar studies from China before, but it's good to know that we're getting it now from well-reputable sources in the UK, in the Western world. This is Imperial College London in collaboration with lots of other people like Liverpool University as well, so it's good quality data. Now, having said that, it's not peer-reviewed yet, but I've looked at it and I think it's pretty good. Not that I'm saying I'm a peer of these people by any means. Anyway, it's actually a really serious study. There's 16,749 patients. And it's looking at 16,749 people admitted to hospitals in the UK. And I think that represents about 28% of all the people admitted to hospital with COVID-19. So it's a big, chunky sample, this. Now, 60% of the sample were men. So 60% of people admitted to hospital are male. And the median age, that's the one in the middle, the median is 72 years. So it's older people that are more likely to be admitted. And just over half had comorbidities. So actually, the proportion that had comorbidities was smaller than I'd anticipated. Now, we're going to look at quite a few clinical features, but as you would expect, the most common were cough, fever, and shortness of breath. But what they identified was symptoms tend to occur in clusters, groups of symptoms that often go together. Now, that's interesting because it means the disease is presenting in slightly different ways in different people, even though it's the same virus, essentially the same virus, presenting in slightly different ways, giving clusters of symptoms which hadn't been identified before. Now, just to give you the good news, pregnancy was not associated with increased mortality, which is good. But of these 16,749 people that were admitted to hospital in this large sample, over 5,500 didn't make it. They died, 33%. Now, that's not saying 33% of people who get COVID-19 are going to die. Of course not. This is just the sample that was sickest that went to hospital. And they represent a certain proportion of those that are diagnosed. And of course, those that are undiagnosed with COVID are for sure in the majority. But it means that those that did deteriorate, there was quite a high case fatality rate among them. So that's the bottom line. I know not all of you like these sort of more researchy type papers, but I think it is important to give definitive research-based information. So if you want to skip this video now, that's fine. I've given you the bottom line. But if you want to stay with it, then it is very interesting and does tell us what we can expect. And as well as that, this is high quality data. It is basically consistent with the other data we've seen from around the world, but it's collected in a more systematic, logical way. It's analysed by some of the best people in the world at this kind of thing. So I believe it does show us something fundamental about the way this virus interacts with the human body. And I would expect the results in other parts of the world to be the same. But bear in mind, all these people received good quality healthcare in the UK in hospitals that for the most part were not overwhelmed. Busy, stretched, yes. Overwhelmed, no. And yet the mortality rate was still 33%. So in parts of the world where the healthcare provision is not as good, we would expect the case fatality rate to be much higher. But I would expect the presentation to be much the same, because I think we are learning now fundamental things about the relationship between COVID-19 and the human body. So let's plunge into some more information now. Obviously, I'm going to give you the links. You can look at this yourself, and I've started pasting all of these notes as well, so you can have your own copy of the notes if you wanted them. Risk factors and clinical features for hospitalisation. So features of 16,749 hospitalised patients. These are studying patients in hospital. Imperial College London, Liverpool University, and lots of other well-respected academics. Only published on the 28th of April, so this is brand new stuff. Now, as I said, it's not peer-reviewed yet, but it looks pretty good to me, and there's a lot of academics in the team already, so that they've obviously peer-reviewed each other, I think. So But I would expect this to be published in the most reputable journal. Now, it's a prospective study. That means they took a group of patients and said, right, let's see what's going to happen to these people over the coming month or 5 weeks. It was observational, so they didn't make interventions. They weren't giving them drugs. They weren't doing anything. They were just observing them. And it was a cohort. And a cohort means a group. So they studied a large group from a particular time into the future. And this is the largest detailed description of COVID-19 in Europe. And they took patients from 166 hospitals. So this 16,749 patients, which is the N, the number of the study, were recruited from 166 UK hospitals. So we're dealing with serious data here. And they took patients' data from the 6th of February through to the 18th of April. So quite a long period of time, 6th of February to the 18th of April. So all through March. So it's a good study. It's 4, 5, 6. Oh, I don't know. It's quite a lot of weeks anyway. 6th of February to the 18th of April. Now, the number is that, as we've said, these are people hospitalised with COVID-19. It's a specific COVID-19 study. And this represents 14.7% of all the people who've tested positive for COVID in the UK. Now, that's saying that 14.7% of people that tested positive for COVID-19 were admitted to hospital. Now, obviously, the real number of patients with COVID-19 was higher than those diagnosed. So this percentage is actually going to be less of the total number that actually had COVID-19, because this is the proportion that were diagnosed. So it was 14.7 of all the people who've had a positive test. Now, 239, 2% were under the age of 18. So 2% under the age of 18 and 1.1% were under the age of 5 years. Now, this is concerning, and we have looked at this new study which has identified an inflammatory disease in children, where there's been about 20 cases so far in the UK. So that severe inflammatory disease which has been identified in children were presumably a subset of these younger ones that have been identified. But I mean, basically what we're saying is 97% of patients admitted to hospital, or 96.9% of patients admitted to hospital, were over the age of 18. But it still means that people under the age of 18, 2%, 2% of the sample, 1.1% under the age of 5. It's not saying that this disease does not affect young people and children. It does. It does. Just less so, thankfully. Men, men disproportionately affected. 60% of the sample were men, 40% of the sample were women. So these are people admitted to hospital. So more men are admitted to hospital than women. Consistent with other studies, but that's good data. That's a large-scale study. 60.02% were men. Now, the results. The median age was 72 years. So do you remember the median's the one in the middle? So you put a long list of the ages, and you take one off the lowest and one off the highest and one off the lowest and one off the highest. And when you've knocked them all off, the age you've got left in the middle is 72. So the median age was 72. Now, the interquartile range, in other words, 50% of the whole sample were between the ages of 57 and 82. But of course, that means that 25% were under the age of 57 and 25% were over the age of 82. So 50% of this sample were between 57 and 82. Again, roughly what we've seen from other studies, but good to get it confirmed by this high quality data. Median duration of symptoms before admission was 4 days. I must say I was somewhat surprised by that I would have expected nearer 7 or 8 days, but interesting. So basically quite a lot of people were deteriorating fairly quickly after the onset of symptoms. So only symptoms for a median of 4 days. And the interquartile range there was 1 to 8 days. So again, that means that 25% of people deteriorated within the first day of symptoms. That's not quite what I understood from before. And 25% of people presented with were hospitalised after 8 days of symptoms. So quite a few people deteriorating really quite early on after developing clinical features. Not exactly what I expected, but this is what the data says, so this is the way it is. This reflects the nature of reality. Median duration of hospital stay was 7 days. Now, comorbidities. Now, we're going to look at the comorbidities in detail, but the commonest comorbidity was chronic cardiac disease. Now, frustratingly, they didn't identify high blood pressure separately. Frustratingly, because we know hypertension, or we know from other studies that hypertension is a significant risk factor. Now, I suspect they've collected that data and haven't unpicked it all yet. So I suspect we are going to get more information on hypertension shortly. But chronic cardiac disease, which of course can be associated with hypertension, 29% of patients had that. Uncomplicated diabetes, 19%. Now, uncomplicated diabetes means that, well, diabetes is associated with complications like blindness, like disease of the blood vessels that go down to the feet, what we call peripheral vascular disease, like complications affecting the kidneys and renal failure. There's a lot of complications with diabetes. And that was saying that the diabetes was uncomplicated. So they didn't have complications. In other words, it was just the diabetes itself, rather than the complications of diabetes that were the significant comorbidity. Non-asthmatic chronic pulmonary disease, in other words, what we normally call COPD, bronchitis and emphysema, 19%, asthma 14%. Now, no documented reported comorbidity, 47%. Again, higher than I expected. So 47% of patients had no reported comorbidities. So, higher than I expected. Increasing age and comorbidities included obesity were associated with a high proportion of mortality. Now, they didn't unpick this one, but there was definite trend that people that were obese, in addition to having comorbidities, or indeed people that were obese who didn't have comorbidities, were more likely to be admitted to hospital and more likely to suffer complications. So obesity is a definite risk factor. Now, I'll give you the link. You can download this PDF yourself, but I just want to show you a quick picture here. Now, these can be a little difficult to decipher, but what we have here is all this side here is men, and all this side here is women. And these are let's just look at the proportion of deaths. So in the younger age group, so 0 to 4, these are the age groups here. And this is the number of patients going out from the middle. So in the lower age groups, we don't see deaths, thankfully. But then as we get older, the dark blue line increases and the number of deaths increase. Always more in men than in women for any age group. So that's deaths in the 75 to 79-year-old age group in men. For that age group, much smaller number in women. Lower number of deaths in very old people, but of course, as we've said many times before, that's because the number of people left in this older age group is less, because a lot have died already. So more deaths in men than women, and certainly more deaths in the older age group, as we had expected. But that is the definitive data on that topic. Well, not as definitive as we get at the moment. Now, so that takes us from comorbidities and risk factors. We will be looking at some more before we finish in more detail. But for now, let's look at clinical features. Now, as you would expect, 70% of the people admitted to hospital had a cough. But of course, that also means that 30% of people admitted to hospital didn't have a cough. So about 70% had a fever. So of course we see there's an overlap between features. Many people had a cough and a fever. Shortness of breath, 65%. So obviously quite a big overlap. People had cough, fever and shortness of breath very often. So perhaps no great surprises there. Cough, fever, shortness of breath, we know that. We are looking at more in detail before we finish. A high degree of overlap between the three common symptoms, of course. Now, reported no symptoms, 4%. Now, I assume these were people that had tested positive, that perhaps had comorbidities that they wanted to observe in hospital. And maybe they went on to develop symptoms, but it's still interesting that 4% of people had no symptoms. But they must have been sufficiently worried about them to admit them to hospital. Now, this is new. Clusters of symptoms were found. So people tended to have groups of symptoms. So it's not an absolute rule, but quite often these groups went together. So cough, sputum, shortness of breath, fever, sore throat, runny nose, ear pain, wheeze, chest pain. So those kind of respiratory symptoms sometimes often went together. As well as the cough, fever and shortness of breath. Other groups of symptoms seemed to predominate were musculoskeletal, so that's the pain in the muscles. Myalgia is painful muscles, joint pain, and excessive fatigue, so they seem to go together as well. Now, of course, you can get some from there and some from there. These aren't exclusive, but these did tend to go in clusters. And then the enteric symptoms. Now, enteric means to do with the gastrointestinal tract, which is all the way from your mouth through to your anus. So it's the stomach and the intestines and the colon and all that kind of large and small intestine. Now, enteric symptoms, because we know the virus, the COVID-19 virus, does infect the gastrointestinal tract, and that virus has often been cultured from stools. So abdominal pain, vomiting and diarrhea features there. 29% of patients complained of enteric symptoms on admission. So 29% is quite high. Getting on for a third of patients had some form of gastrointestinal symptoms when they were admitted. Mostly with respiratory symptoms as well. So these tended to go together. So they had respiratory symptoms, but still 29% also had gastrointestinal enteric symptoms of abdominal pain, vomiting or diarrhea. And this is interesting and roughly consistent with what we've seen before again. 4% of patients described only enteric symptoms, so only abdominal pain, diarrhea or vomiting, but only 4%. But it just shows it can happen. Now the outcomes of this study. And it's really quite sobering because remember we are dealing with a sample size of, what's the sample size? 16,749. Quite a large sample size. I think this sample was 28% of all the patients admitted to hospitals in this time period with COVID-19. It's a big sample. 49% were discharged alive, but 33%, which is over 5,500 people, died in hospital of those admitted. So quite a sobering figure there, really. 33% of hospital admissions died. By the time the study ended, which was, when did the study end? Ended on the 18th of April, 17% were still in hospital. And by coincidence, 17% required admission to high dependency unit or intensive care unit. Now, high dependency unit is where you get more care. Intensive therapy unit is where you can be mechanically ventilated. That's the difference between those two. Clearly, the mortality were higher in the group that were admitted to HDU or intensive care because they were sicker. So 45% of that group died. That's the subgroup. And they tended to require care for longer as well, 24% still requiring care at the end of the study period, which was the 18th of April. And over half of those who were put on mechanical ventilation died as well. Now, the women who were of childbearing age who were admitted, now thankfully there were very few, let's just remind ourselves. So here we have that second screen. So here we have women here. So let's say childbearing ages from teenage years, the group here up to say 45, that group there, of that group, firstly there weren't that many women of childbearing age admitted, which is good. There weren't that many of them. But of that group that were admitted, 6% of those were pregnant. So of the women in childbearing age who were admitted, 6% were pregnant. And now apparently, I had to check this, apparently that's about right. So if you round up 100 women, if you take a random sample of 100 women between the ages of say 19 and 40, having 6% of them pregnant at any one time is not surprising. So doesn't seem to be that pregnant women are admitted disproportionately. And this is a major relief, actually, and it's great to see this confirmed. Pregnancy was not associated with mortality, and in apparent contrast with influenza. So the group is saying that influenza in pregnancy is probably associated with more mortality, but with COVID-19 it was not associated with more mortality. Now this is quite a relief, because in the early days of these videos I did look at studies on MERS and SARS from 2002, 2003, and there were effects on pregnancy and there were effects on miscarriage, but this was not identified in this study. Pregnancy was not associated with mortality, so pretty good news there. And of course most of the women that were in childbearing age, we just have a quick look at that again. So most were discharged, some required ongoing care. So for example, women 35 to 39, most of them were discharged during the study. Again, most discharged. In the age group of 20 to 24, all were discharged. In the age group of 15 to 19, all were discharged. So pretty good news there, that they're not getting more severe illness. Now, just a couple of more things to look at a little more detail. Now, this is whether someone has a particular comorbidity. That means they don't, and that means that the data wasn't recorded. So let's just look at this in a little more detail. So, what we see is chronic cardiac disease was the most common comorbidity. Then diabetes without complications. Chronic pulmonary disease, as we mentioned, chronic kidney disease, asthma, dementia rating there, chronic neurological disorder such as Parkinson's disease or motor neuron disease, malignant neoplasia, that means cancers, rheumatological such as rheumatoid arthritis, obesity, diabetes with complications, smoking, not as high as I'd thought. So smoking doesn't appear to be such a big comorbidity in the UK data as in the Chinese data, but I would still suggest you don't smoke. Chronic blood diseases, malnutrition, moderate or severe liver disease, mild liver disease, HIV, AIDS. Pity they didn't have one for vitamin D. Anyway, they're the comorbidities that they identified, and you can see the percentages there. Again, if I zoom out, you can probably see the percentages clearer. So that's the 25% mark there. That was the 50% mark there. So they're the comorbidities identified. And the last slide is the full list of clinical features. And again, we can see 25, 50, 75% there. So quite a few times the data wasn't collected. That means it was collected and the answer was no, but this is the ones that had it, that had the clinical feature. So let's just go in a little bit and look at this. So most had a cough, and that relates to what about, well, we did give the precise percentage, didn't we? It was about 70%. Most had a fever, most had shortness of breath, most had fatigue. Now, confusion, this one's interesting. Quite a lot of people had confusion. We call this altered mental status. And it does happen quite often, especially in the elderly, when they get infections, that they become confused. And given that the median age of admission was 72, wasn't it? Then it's perhaps not too surprising. Cough that developed sputum that became productive. So dry cough is the classic clinical feature, but still quite a few developed sputum and were coughing things up. Diarrhea, vomiting, pain in the muscles, chest pain, headache, wheeze, sore throat, abdominal pain, joint pain, runny nose, not that common, as you would expect, because it's not really a condition of the upper respiratory tract. Certain amount coughing up blood, that's quite a disturbing feature. That's called hemoptysis. Skin ulcers, that's a bit of a strange clinical feature. I'm not familiar with that one. Not many had a rash. The skin ulcers may have been associated with other conditions such as diabetes, actually. Not many had a rash. Thankfully, not many fits, seizures. Lower chest wall in drawing is when someone's finding it very, very difficult to breathe in or breathe out, and there's paradoxical movements of the muscles of respiration. Bleeding in other places, hemorrhage, thankfully not common. Lymphadenopathy means swelling of the lymph glands, so not common. Not common. Ear pain and conjunctivitis is inflammation at the front of the eyes. So again, not too common there. Okay. So that is pretty good quality definitive information, so it's good to have. Largely confirms what we've already thought, but a few surprises there. So interesting, and as I say, I believe now with the quality of this data, this is saying something fundamental about the interaction between this COVID-19 virus and the human body. And I would expect the presentation to be very similar in other parts of the world. Unfortunately, with a higher case fatality rate, if as much hospital care was not available. Now let's just finish with a few Friday viewers. Where are we here? Don't want to see me, do you? Want to see the viewers. Okay. So this is can't quite read that. I think it's Michael from I think it's from the United States. Anyway, you'll recognise yourself. This is Mortaza, whose name I've pronounced wrong. My apologies. PS, where's PS? I completely forgotten, sorry. Paul and Ava taking good levels of precautions in Ohio. And they go shopping. Good to see they're wearing masks in case they have the disease. They will protect those around them. Sammy from Finland. Sammy's actually watching one of my old videos here. This one's on the respiratory system. So that's me blowing up a balloon to represent the alveoli. So if you wanted to catch up on the respiratory system videos there's lots of other anatomy and physiology videos on this channel. You could spend a lot of time watching those during the lockdown if you'd like to. Here we have plenty of cats. That's from Shinoak. So I'm not very good with names, as you've probably realised. This is Tarsila in Brazil. Excellent picture in Brazil, thank you. This is Thomas from the Czech Republic taking mask wearing to the extreme. Glad to see Thomas has taken measures not to run out of beer. This is Tori. Not sure about the name of the dog, sorry about that. Thanks, Tori. This is Vex in Amsterdam with a very frightening mask. And that's it for today. Thank you to all the people who sent pictures in.